Before I got sick, I was a very active person. I began to slow down and I thought it was my age until it got to where I couldn't do anything simple like taking 12 steps and I would be breathing like crazy. I made an appointment with a pulmonologist in Amarillo. I'm from Amarillo. They found a blood clot in my right lung. My pulmonologist recommended that I go to UT Southwestern.
We started our chronic thromboembolic pulmonary hypertension program in 2017, and we did so because there were many patients in our region that we realized were not able to get the specialized care that they needed. Chronic thromboembolic pulmonary hypertension is shortened to CTEPH. CTEPH is a rare disease that occurs in patients who've had blood clots. Blood clots are pretty common in the United States. About 500,000 people a year get a pulmonary embolus. And normally they get put on blood thinners for that pulmonary embolus and it dissolves over time and patients go back to their normal lives. In a small percentage of patients, maybe about 2%, those blood clots don't dissolve and they actually scar on the inside of the blood vessels in the lungs. And when that scar happens, it starts to obstruct the vessel or block it up. Mr. Dudley came in with a lot of short-windedness. It was really affecting his quality of life.
When I began to have these symptoms, I was fairly young. I was 69 when it started, and I figured I was over with because my life had changed so dramatically.
Surgery is our first option. It is the best and most proven treatment in getting patients back to a normal lifespan and a normal quality of life.
One of the particular specialties that I perform is pulmonary thromboendarterectomy. This operation is one of the higher complexity operations that we or any institution does. The patients require a great deal of meticulous care, and our pulmonary hypertension group is very experienced at managing them. And we're able to treat patients all over the state and all over the region. Mr. Dudley was a unique case for us. He had had prior coronary artery bypass grafting. Those bypass grafts are the lifeline to the heart, and in the reoperative field, they're oftentimes scarred in, difficult to identify, and any injury to them can cause catastrophic complications. So it adds a layer of complexity and risk to an already challenging operation. It's a long operation, usually lasts at least 8 hours. It's an open heart surgery. We use the heart and lung machine, which is also called the cardiopulmonary bypass machine, just like we would for any other heart surgery. In this operation, once we go on the heart-lung machine, we actually have to cool the patient down to 20 degrees Celsius, and that allows us to do what we call deep hypothermic circulatory arrest, where we temporarily stop the blood flow through the whole body. At 20 degrees Celsius, the metabolic activity of the organs is so low that blood flow is not needed. We can see all the way out into the periphery of the pulmonary arterial tree. We're able to clear the disease in that area by having a bloodless field. We did find a heavy burden of chronic blood clots in there that we were able to remove.
The second day after surgery, I realized by moving in the bed, getting up, that I could actually do it and not have to look for an oxygen mask. I could breathe again. It made me feel like I was 10 years younger.
By the time they come back to the clinic a month later, most of them are feeling essentially normal again, and that's one of the more gratifying aspects of this job.
When we can find disease, and especially disease that we can fix and treat, and then I get to follow them up and see them doing the things they want to do with their lives later. So as a physician, it's one of the more rewarding things I get to do.
I'm right back to doing what I like to do. One of the favorite things I do with my grandkids is to attempt to introduce them to fishing. I like to watch the kids learn new things that are old to me. I want them to learn all they can. The care I got, not just from the doctors, but the staff, the entire hospital, definitely has changed my life. It's given my life back to me. Thank you.